Good day, everyone. Whether you're listening to this video live or whether you're listening at some point down the road as you're doing daily business, taking care of your daily business, whether you're listening to it in the future. I do want to say on behalf of Chom's Medi Helps Foundation, thank you very, very much for tuning in and watching and listening and learning. Tonight, week three, we have on our educational series, we have Miss Karen Curtis. Miss Curtis is leading the way because she is the founder of the Care Partner Project. And you say you don't know what the Care Partner Project is? Well, that's exactly why we host these weekly patient educational series because we know that there are a ton of patients out there that they need the resources. They don't understand. They have questions. They're like, well, how do I do this? And how do I do that? And what am I supposed to be doing? And nobody's helping me. There's help. You just need to know where to go to get that help. There's options. There's always options available to you. And so our hope with Chom's Many Helps Foundation is as we bring you these options and we bring you these resources, that when you or your loved one needs some options, some resources, you could turn to the information that we're presenting to you. Now, please note, this is a disclaimer. The information shared on these videos is not, it's not that it's not factual and it's not that it's not data, but it is not something that say, okay, well, I heard Karen Curtis tell me that I should be telling my doctor. Yeah, no. Listen to the information and use the information wisely. Thank you so much for doing that and appreciate it. Now, without further ado, like I say every Wednesday, I'm going to sit back, I'm going to listen, and I'm going to be educated just like everybody else. So, Karen, can you please tell us, what the Care Partner Project is, and to share with us some information that all of us as patients we need to know?
Thank you very much, Sandra, for hosting me tonight because you hit on something that's very important. SEO for the Care Partner Project is really impossible because people don't know that they need the kind of information that we share about navigating the healthcare system until they're in the midst of it and usually in a crisis, and there are no handy search terms. There are no keywords that get people to our site because most people don't understand that healthcare is so complicated uh, that you just don't know. We just don't have the vocabulary for searching for help in our healthcare system. So thank you for the exposure and for supporting the Care Partner Project. This is International Women's Month, and I think probably most in the audience are women listening tonight, because what we have in common as women is that we are the caretakers for our families. We are the ones that when somebody is very sick and needs help, it's the women who pitch in to support our loved ones and the kind of care that they need. That's not to say that our sons aren't being trained to do that, but right now, this is falling on women's shoulders. So what we also have in common actually with everybody in the entire world is that there is nothing in life that prepares us for that role. There are no classes. We don't cover it in health classes in grade school or middle school or high school or college or wherever. There are no community college classes. There are no Girl Scout badges that we can earn in healthcare. We have to learn it on the fly and on our own. And we have to do it by sharing knowledge. So thank you for this platform to share the Care Partner Project. I started the Care Partner Project when I was in that situation myself with my dad, because we all show up, right? Your loved one is in the hospital, you show up. And I didn't realize how clueless we were until we did show up, me and my 5 siblings and my mom, and dad was failing. He had succeeded in getting a very rare lung transplant for a rare lung disease. But he ultimately died because of the care that he received afterwards in the hospital. And we were flat-footed. We didn't know what we could possibly do to prevent the hospital infections, blood clots, falls, and so much more that he suffered, that, and their common complications that really took his life, despite the fact that he had a brand new lung. So I decided to start the Care Partner Project because I wanted everybody, I wanted nobody actually to go through what we went through, which was to see the hope of life and promise of life turn to dust. And whenever I think most of us are in awe of the skills and the equipment and the facilities that our healthcare system does offer. However, there are cracks in care that we have to know how to fill. Preventing infection, for example, which affects claims about 100,000 lives a year. Hospital infections are things that we can learn to do to help save the lives of our loved ones. So at the Care Partner Project, we have simple checklists that anyone can follow to help prevent the most common preventable hazards in our healthcare system, whether they occur in the doctor's office, whether they occur in the hospitals, emergency rooms, during childbirth and delivery, or hospice and palliative care, we have a checklist for you to follow. Simple one-pagers that kind of fill you in with what the issue is, what the concern is, what the risks are, but then your to-dos, very simple to-dos. And we built all of our information around checklists for a simple reason, is that we're all learning on the fly. We're usually learning in a crisis with a loved one who is ill, and we're, as I said, we're caught flat-footed, so we've got to pick this stuff quickly. And then also, I was inspired by a book called The Checklist Manifesto, written by Atul Gawande, about very complicated projects like building the Sears Tower here in Chicago started with checklists that architects, engineers, and construction people all use. So I thought, well, if we can build the Sears Tower in Chicago with checklists, we can create safe and sound care for our loved ones. And we can do it one simple checklist at a time. So when you go to the Care Partner Project, you will see everything explained on the web pages, but you will also see that you can download absolutely everything. Hey, I want this checklist, because I know my loved one has had some falls recently. They're going into the hospital. I'm worried about them taking a fall. And believe it or not, falls contribute to so many preventable deaths in hospitals. And there's a whole background about it, and then what you can do. But you press a button and you can download that checklist. You can read it on your phone, on your iPad, print it out, and take it with you. And it's meant to be very handy, quick, simple. And it's as I said, it's intended to fill in all those gaps of education that we never got anywhere else, and to do it in such a way that we can learn very quickly in the moment of care. One of the things that we often think about hospital as being for people who are older, but all of these potential hazards in care, they're age neutral, gender neutral, color neutral, religion neutral. They happen, and everybody is at risk, and everybody can help pitch. And one of the things that I do like to emphasize is that, and I don't think it's any secret, COVID, we have had an exodus of physicians and nurses. It's even more ever since COVID. As you all know, it's terribly hard on our healthcare system. So more than ever, we need to know how we can help pitch in. They're good people doing good work. Can't do everything. So if we learn how to do all of those very simple things that add up to safe care, and we're not talking about becoming medical treatments. We're talking about doing simple things like taking your bleach wipes and wiping down the bed rails in your loved one's room so that they don't pick up germs like C. diff and other kinds of infection. Very simple little things. We're not in any way getting in the way of medical care. We're just doing sort of the simple things that that nurses and physicians simply don't have the time to do, but we learn. So
You know, and what you just no, I'm sorry, Ken. What I was going to say is what you just said is so true, right? We all know, and it's not just new, right? We know for the past 20 to 30 years, since healthcare is no longer healthcare, it's all about business. We know that we can't put everything on the nurses and the doctors, right? We know just from listening at the TV or reading the newspaper, we know that C. diff and all these fungal infections are coming about. We're hearing more and more about it. So why should we not, as patients, understand that what we have to do is we have to own up, right? We got to take responsibility. We got to take some responsibility for protecting our health. We've got to step up to the plate and say, okay, I'm going to go to the doctor's office and I'm going to be prepared. So I thank you so much for bringing up that part. And I'm going to allow you to go ahead and finish your thoughts. We have like 4 minutes left, so I'm going to allow you to go ahead and finish your thoughts.
Okay, well, thank you very much, because I realize I've been focusing a lot on hospital care, but I want to also point out that we have checklists to help make sure that you get the right diagnosis and treatments for you. Approximately 40% of all diagnoses are incorrect. And it's very important to get as many questions up on the table, make sure that the diagnoses that you get, because they guide your treatment options too. If you have a diagnosis for osteoarthritis, for example, when in fact you've got, a weird little fracture, those are two different kinds of treatments. So it's very important that you have a good set of questions to really dig and dig and dig. And then also we have a set of checklists so that when you go to your doctor's appointments, that you are buttoned up, organized, and you make the most of every single minute that you have there with them. That they are stretched for time. Usually they can only give like 15, 20 minutes. Sometimes you get 30 minutes with a doctor. Well, it's your health. Every moment has to count, and you don't want to be in the parking lot leaving saying, oh my gosh, I wish I had asked that question. So we have all kinds of checklists to help prepare for a doctor's appointment and telehealth appointments. And also labor and delivery and pregnancy. We have a problem in this country of not being able to deliver safe childbirth in this country. And I know it's a shocking data point, but of all the developed nations, the United States is one of the least safe nations in the world, in the developed world, to deliver a baby. You need to be prepared. You need to have your care partners, and you need to know what to watch for, what to look for, and say and do to get safe care.
And Karen, with that being said, I thank you so much for that for sharing that information. And once again, whether you're viewing this video live, I do see that we have 2 live people, and I want to say thank you very much to Carolyn Coleman for watching. And Ray Lee actually said she totally agrees. She agrees with what is being discussed here. And that's right. We should all agree with what's being discussed here, right? And, the 3 pillars of MediHealth, CHOMS MediHealth, are patient education, patient engagement, which you're not going to have if you do not have patient education, and patient empowerment. Once again, you cannot have an empowered patient if you're not educated. So whether you're listening to this live or whether you're watching this afterwards, please take advantage of the resources that are being shown to you. If you have any questions, please feel free to reach out to Karen. Or you can send me an email and say, hey, Sandra, I want to learn more about the Care Partner Project and what are they all about. Please reach out to me. I'll send you the information so that you have it as well. And you know what? When it comes to our mission statement, the CHOMS mission statement says that we are designed to help the underserved and the marginalized. Yes, there is a difference between the two. And most people don't realize that there's a difference, but there is a difference between the two. An underserved population are women. I don't care what color you are. If you are a woman, you are definitely considered to be an underserved community, an underserved population. Just look at all the news stats and all the data, especially the data that I throw out on our private Facebook group. You'll see that we, in fact, are underserved as women, and it has nothing, absolutely nothing to do with the color of your skin. We are also, as Karen stated earlier on, we are also the ones that are generally in charge of not only protecting our own health, but protecting the health of our family and friends. So with that being said, I just want to once again thank Karen on behalf of the CHOMS Many Helps Foundation for being our guest tonight. And I want to close out by asking her if she has any final thoughts that she would like to add to tonight's conversation.
Well, we're always evolving. Thank you for that. We have a newsletter where every Tuesday we send out tips, and we do stay on top of the news. And we try to tailor our tips to kind of the latest developments in healthcare. So it's free, of course. Everything we do is free. So come to our website, sign up for our newsletter. Bottom of almost every page in bright green, and we'll stay in touch. So please do visit us. Please share with your family.
Thank you so much.
Thank you.
Thank you so much, Karen. And I look forward to talking to you some more. And I look forward to having you back as a guest. Once again, I'm hoping, I pray all of my guests, love them to death. I'm hoping that all of them, as I say, hey, we're doing this, if we can get involved to keep this patient community growing.
Thank you.
So thank you so much, and have the rest of a great evening.
Thank you. Thank you for everybody for attending.
Okay, thanks, Karen.
Oh, that was great. You made it so easy for me. I was nervous, and you put me at ease. So